Welcome to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association Sport Laboratory. Dr. Andrea Straccolini is a primary care sports medicine physician at Boston Children's Hospital. She is also the director of the section on performing arts athletes in the Division of Sports Medicine and assistant professor of pediatrics and orthopedics at Harvard Medical School. She's board certified in pediatrics, pediatric emergency medicine, and sports medicine. Her research career centers over overuse injuries in young athletes, injury prevention, exercise deficiency order in youth, and performing arts athletes with a focus on health maintenance. In order today to make today's JAT Chat work as smoothly as possible, we ask you that you submit your questions in the Facebook Live comment section or as a tweet at JAT_NATA using the hashtag JATChat, all one word. At this point in time, I would love to introduce Dave and Andrea. Thank you guys for coming to speak with me today.
Thanks for having us.
Thank you, Kara and Chris, for organizing. It's a pleasure to be here.
Yeah, so I'm sure there's going to be lots of questions coming in, and we're actually having some questions start popping up already, but just could you give us some overview of what should readers expect from this special edition on sports specialization?
Yeah, sure. So just a quick overview. There are two editorials, and one of those editorials is from Brian Hainline, who's the medical director for the NCAA. So I think that one's particularly interesting. We also have 4 narrative reviews in there, which are in essence literature reviews. So if you don't know much about sports specialization or the sports specialization literature, that's a really great place to start, because we have ones that focus on kind of the broader public health consequences, kind of the big picture. We have ones that focus on upper extremity injuries, lower extremity injuries, and then also the psychosocial side of things. And then we also have 10 original research articles that are in that special issue as well, that focus on a lot of those same topics, but they provide some of the really empirical evidence that are really important to moving the field forward.
Great. Thank you. So the first question that we're getting from the audience is right off the bat, how old is appropriate for specialization? And does it vary by sport? Which actually you guys do mention in one of the editorials, the differences in sport. So can y'all take that?
Yeah, sure. Maybe I'll take a first stab at it. And then Andrea, if there's anything you want to add, you can feel free to. The tough part with specialization is that we're seeing this phenomenon occur earlier and earlier. We know there are different factors that influence specialization rates. So for example, school size is going to be a big one. So if you go to a larger school, there's a lot more pressure on you to specialize. We also know that it's dependent on the sport that you play. So for example, football players, there's not a whole lot of highly specialized football players, especially in those younger cohorts of individuals. But as you get it, specialization used to be reserved for sports where you had performance needed to peak prior to puberty, right? So these would be sports like figure skating and gymnastics. But now we're seeing in specialization in sports that peak performance occurs after puberty, right? So, and basically kind of pick a sport that you might find in high school, and sports specialization is now there. It's pretty much ubiquitous. And I think part of the problem here is that we're seeing some sex and gender disparities as well. So if we look at the whole population, women are going to be a little bit more likely to be classified as highly specialized compared to men. But when you compare some of those sports, so let's say male and female soccer players, men and women are relatively comparable in their specialization rates. The problem with age is that age is just a number to a lot of people. And there's a lot of behavioral, hormonal changes that are happening in kids, and these all happen at different times. So recently, we just had the NATA adopt our sports specialization recommendations. And in there, what we said was that we basically want kids to delay specialization as long as possible. So if you can delay specialization all the way up until your senior year in high school, that's great. Do it as long as possible. I don't want to say like, I don't like giving necessarily.
If we make these blanket statements. So I think it's a harder question than people realize, and we really have to kind of suggest that people delay as long as possible and continue to look at it with each individual sport.
Especially with your role with performance medicine and dance, you see a lot of early specialization in that population. What conversations are you having with those athletes?
I mean, I think that that's absolutely right. So I deal with the dancers, the gymnasts, the figure skaters. And to Dave's point, some of these young performing artists really may need to specialize in order to achieve their goals. And I think, you have to guide them as a clinician. The parents ask me that question all the time. And I tell them, I think that the literature is starting to really support that doing multiple activities in sports really can be beneficial for longevity, for overall psychosocial health and overall well-being of your young performing artist athlete. And I just give them the guidance to move forward. And if they choose to specialize, then I think we help them in terms of helping negotiate volume and training load, et cetera, through that process. So it really is an important conversation to have with all your athletes and performing artists, for sure.
And something similar, another audience question is, so my child is specialized at a young age and they seem to like it. What strategies can I utilize to try to get them to take time off or to diversify?
Andrea, do you want to take that one? Or
Sure. I mean, I think first of all, I think we need to emphasize how important it is that these kids continue to have fun at a young age in what they're doing. And I think for me, working with these young specialized athletes is important to make sure that they are having fun throughout the process. You emphasize that to the athlete or the performing artist.
So, for example, these include make sure that your kid or child is participating in, no more than 8 months per year of the same sport, right? So this means like you can go for a season, take a little bit of a break, go for a season, take a little bit of a break. It doesn't have to be play for 8 months and then take 4 months off. And in that time, it can be active rest because we understand that like kids love sports, right? And a lot of kids have, and we can't, as part of this conversation, lose sight of all the positive things that kids gain from sports as well. The other recommendation that we like to give people is the hours per week related to your age. So if you have, for example, a 13-year-old soccer player, that athlete should be participating in about 13 hours of organized sports per week. And so that includes soccer, that includes dance, for example. That just makes sure that you have a really good balance between life that's happening and the sports that they're playing. So that's a pretty good rule of thumb as well. And then part of our recommendations is that kids should be getting, especially those younger kids, they should be getting at least 2 days off away from organized sports per week. Rest is one of the things that I think that we kind of continually forget about. And so if your kid is liking sports and they're having fun, if you follow these recommendations or try to implement some of these recommendations, then hopefully your kid will win the lottery and they'll get a college scholarship and they won't get injured and they'll have a wonderful positive experience with sports.
And I'll just add to that a little bit, Karen, that if in fact, they're gymnasts and they're at 18 or 20 hours a week and they're there, then I think the onus is on us to look for these signs of burnout. Like, are they starting to look fatigued? Are they really starting you see their anxiety level climb? Are they losing that fun factor? Are they starting to show, their academic performance is starting to wane? Are they not sleeping and the nutritional status is suffering? And I think it really is our job on the side of caretakers and clinicians to make sure we are looking for those things and keep
not going to the park, right, and playing with your friends and doing some free play. To me, that's different than what might count towards that hours per week. Because I think what we hear a lot of kids do is, you have a coach, for example, who wants to have, who's developing their plan for the season, right? And during that season, they have these specified off days. And unfortunately, I think a lot of times what we're hearing happening is that, it might be in season for soccer. And during that in season for soccer, they have an off day. And that kid is going to go play for another soccer team or another travel league or another volleyball team. And they're doing something else and they're not using that rest day to its full advantage. And so If kids can just have those breaks on those days that are designated break days, then I think you're going to do them a lot of positive benefit.
And I would just add that, and Dave, you can chime in here, but I think break days don't mean sitting on the couch, right, and watching TV,
right,
or on their phone. So just to be clear, when we say break days, we mean break days away from their organized activity. But going outside and playing pickup basketball, I still consider valid on a break day, or, a pickup game of, girls going outside and riding their bike or playing tennis with their parents. Mm-hmm. Those are really important days. And I would put that as legit activities for a break day.
If you're going to go somewhere and do an injury prevention program for an hour, you're probably not doing kind of the injury prevention program that I'm thinking of anyway.
Yeah, I think the lines get muddy here, right? Because we also have to talk about volume, right? Yeah. So I think, when you're developing skill, how are you developing skill? Is it personal training? Is it coaching, et cetera? And then so that we definitely separate out from, as Dave said, organized sports participation. But then, we can't discount that from looking at the overall volume of training for these young athletes. So the lines get a little bit gray. It's a little bit tricky, but nonetheless, I think we have to pay attention to all and continue to focus on the longevity, right? Keeping kids healthy in the long term. So you start off with just how many teams and how many hours per week. And then they're sitting in your office, and it is really, the realization is really interesting to see the parent's face. And then sometimes they'll say to you, "Oh, I bet you this is an overuse injury." Like they come to that by themselves, and you're just the passive person in the room asking a couple lead questions. And I think that's every opportunity, when you have your patient and you're asking these questions, is an opportunity for education. And I think it's really important that every caretaker use these opportunities to educate with regard to even these hours per week recommendations. The parents love that because it gives them something to hold on to and to, before these papers came out and this research was happening, we had no idea how to advise parents. We were pulling it out of the air. And now we can say, hours per week, per year and age. And that gives these parents, they love this stuff. So it really has been helpful, and the research has been really monumental. We just have to keep it going.
Yeah. Let's switch a little bit and talk more about educating coaches and admin. So one of the questions that we got was, the current big problem seems to be young athletes that are playing school, rec, and club sports all at the same time, and there's no communication between the stakeholders. What are strategies to bring these different coaches and administrators to make sure that young athletes are not getting burnt out or injured?
Andrew, do you want?
Dave, you take this one first, and I'll add.
Yeah, sure. So this kind of gets at the question that the scenario that we were just talking about, right? Where you have a coach who does planning, and then during that off day, they're going to go play another club sport or another tournament. And so for lack of a better person, the parent has to be the parent here. And I think that they're going to be the one who has to advocate for their athlete and their child. And they're the one who's going to have to probably say no, because we have some data that basically shows that kids understand sports specialization. They understand the risks of sports specialization, but they also perceive benefit from it because they feel like it helps them make, for example, their high school team, or they feel like it's going to help them get a college scholarship, for example. And they don't really care about overuse injury. And if I channeled 12-year-old me, right, I would probably be in the same boat where I would be like, I just want to play, right? I don't really care. I've got these coaches, they're counting on me to be here. And so it's really the parent who has to come in and say, I understand that this is important to you, but we need to back off and give you a break for this specific reason. Currently, that's the best strategy that I have. I think perhaps maybe at some point there might be some apps that are being developed that might be able to kind of help keep track of some of this information. But right now, it's going to be really reliant upon the parent to get that information out there and to advocate for their child.
Yeah. So Dave, I'll throw this back at you, but I think it's when I have this question and the parents and the family are in the room, I start talking about the ecosystem of sports and the economic ramifications of sports specialists, and the parents get that. And I think that really drives it home. Like, look at the money you're spending and for what's the end game or what's the goal. And, then they start to say, okay, really, who is this benefiting? And it really gets the wheels churning. So I think if you talk, economics and sport ecosystem, it really helps educate the families. I think that makes a huge difference. Just like Dave is saying, use the parents and empower the parents. So.
Yeah, it's funny. My wife had a coworker who was going through this actually just last week and got to the point where she added up how much money she was spending on her children's dance. And it was already at $7,000 and she hadn't counted the hotel rooms in that yet. And so probably easily $8,000 or $9,000. And we hear that number over and over again, that parents are spending at least $10,000. Some parents, not everyone, right? But some parents are spending up to $10,000 per year, per child on sports. And so you have to ask, you have to do the risk, the weight and the benefit ratio out of that, and to make sure that it's benefiting the kid and the kid still likes it, and the
economics to the family unit, but economics in general. Dave, can you touch on that?
Yeah, sure. So we tried to give relatively rough estimates, and I would just put a big asterisk beside these numbers because I don't think the actual numbers themselves actually mean much. But what we were able to calculate that based on all of the data that we currently have that's available, we're spending somewhere between $800 million and $5.2 billion per year on injuries that could be at least partially attributable to sports specialization. And so, those are the first time that we've tried to actually put a number next to how much this might have impact on the economic cost. And this is just kind of the injury cost. Mm-hmm. And again, I don't think the numbers are so important, but I think what that does is that puts sports specialization in the same ballpark as to a lot of other injuries that we think are particularly problematic and very concerning. So those numbers are similar to the concussion numbers. Numbers are similar to the ACL numbers that are out there, to the Tommy John numbers that are out there. So, so from a societal bang for your buck impact, it's really impacting our medical costs, and they're quite significant.
So let's talk more about the injury aspect. So one of the audience questions is the increased injury risk associated with early specialization really just due to increased exposure to risk, or due to increased volume of exercise or increasing exposures?
Andrea, do you want to take that one, or do you want me to take that one?
I think, some of the newer data on sport, I think you can't ignore the volume piece for sure. And so I would have to emphasize that we know that with specialization, with kids who specialize, the hours increase and training volume, those two things go hand in hand.
Is that a lot of these athletes are actually highly specialized all year round. So they've chosen a sport, for example, we'll just say volleyball, for example, and they're playing that sport 12 months out of the year. And they're also beginning to layer other sports on top of that. So for example, this is those kids that are, for example, during basketball season, during their off day, they're going to club volleyball practice and they're playing club volleyball. Those kids are actually high volume, high specialization athletes because they're doing both things. And those kids are actually, at least with our early preliminary data, actually some of the highest risk kids that we have. So that's why one of our recommendations is one sport at a time also. So if you're playing basketball, great, play basketball that one season and try not to do the other sports simultaneously, because being highly specialized in one sport and then layering other sports on top of that really seems to increase your risk of injury.
Yeah, and I think that just to be aware that once you have in that increased volume, those increased training, it displaces other things. And I think it's important for everyone to realize how much other things are displaced, including family time, including sleep, including attention to nutrition, right? Especially for our performing artist athletes. So, these things get displaced or get knocked down on the priority list. And I think we're losing our focus on overall health and well-being for these young athletes.
Yeah, and I think the numbers back that up from what Andrea just said, right? I mean, you might have a 10-year-old that you think needs to do everything they can to try to make their high school team, but the numbers show that athlete is actually much more likely be a dropout of sport and to not continue to participate anymore. I mean, the numbers show overall that about 70% of kids are going to drop out of organized sport by the time they're 13 years of age, and girls drop out of sport faster than boys. So you might think you're doing your child a favor, but if you're training your 12-year-old like a professional athlete, their career is going to be very short, and they're probably not going to make it till they're 14 years of age. Maybe they do, but the data shows that they're much more likely to eventually drop out because they're missing the time with friends, the time with family, right? The very basic things that human beings really enjoy and love.
And again, I think that translates to lack of long-term physical activity. So if you're looking at economic burden on healthcare, it's huge, right? Because now you have a dropout earlier in life, and that long-term sustained physical activity, is a big problem. So the hours of training and what that young athlete is doing, and then looking for these vague signs and acute changes are really important. So, are they starting to show these depressive patterns? Are their anxiety levels starting to increase? How are their grades doing? Look at trends over time. So I think it's important to be aware of the signs of burnout. They can be very vague and difficult. And then once you detect those, use your team, right? So we have psychosocial support right in our clinic that can meet with these young kids and talk to them about the stressors and the anxiety of being in a high pressure situation. So we have psychosocial counseling that can be very helpful. Use your healthcare team, your primary care physician or nurse practitioner, people that you have good relations with, your athletic training staff, of course, right there. They're that front line. So, and they can be very helpful in helping these young athletes navigate these stressful situations. So I think you use your healthcare team and your professional team effectively. You look for your signs and symptoms because they can be vague, but you have your feelers up, especially for those high risk athletes, and you act accordingly.
Right. So how can athletic trainers be advocates for these recommendations that are being put forth on sports specialization?
Yeah, so athletic trainers are at the front line, especially athletic trainers that are at the secondary school. Those are the people that a lot of individuals oftentimes turn to for education, for different educational resources, right? So, for example, a lot of the recommendations that we have, we also know that almost no one knows about these recommendations, that 80% of parents don't know about them, that 80% of coaches don't know about them. And so the athletic trainer can really play a key role here in making sure that everybody is on the same page, and can also help inform policy about how to, at different schools, about how to kind of address some of these issues. Because I don't think, we're not going to solve sports specialization here. It really has to be a bottom-up approach, which we're doing, but I think it also has to be a top-down approach where different entities can implement policy. And I think an athletic trainer can be a really key part of that team moving forward for a school or for an organization.
So as we kind of wrap up, I want to ask you guys two questions. The first one, let's start with that, is how are you personally as a clinician trying to influence the culture of sports specialization?
How am I personally trying to?
Yeah. How in your clinical practice are you trying to influence sports specialization?
So I think that's, for me, it's multi-pronged. So one, it is, just as I spoke to earlier, is every patient interaction for me is a opportunity for education. I have a parent, I have an attentive parent in the room and an athlete. I have one-on-one attention. So I use that to the greatest degree, and I use that as an education. And then I think making sure that I'm a voice, right? I do the research, but I'm out there lecturing in my community and nationally, spreading the word. And I think that's really important. So for me, it's really being a one-on-one advocate for these athletes when I have the patients in the room. And then two, doing really good research and then spreading the word with getting out there. So, yep. Dave?
Yeah, I think dissemination and implementation of these recommendations is going to be really hard to do, but I think it's the right thing to do. And so, I'm trying to do the same thing. We have these recommendations that we've developed over time that are evidence-based, or not that I personally developed, but we put together in this kind of package. And, we think that these recommendations can really help people, and we think people really like them because they do have numbers associated with them. And we do think that they've kind of gone a step further than maybe other recommendations have gone in the past or have been able to go in the past. And so we're trying to shout this from the rooftops as loud as we can. And we're trying to at least try to get some research money to see if we can determine if these, to keep determining how these are effective and if they need to be modified, and to make sure that they're evidence-based.
So then, especially for you, Dave, starting off with you, how are you dealing with this as a parent?
Yeah. So I have two boys, a 5-year-old and an 8-year-old. So we're just getting into this whole process, right? Of the 8-year-old very much just likes to play a lot of things and likes to experience a lot of things. And so, we haven't had a conversation with anyone yet that says, you have to do X in order to keep going so you can do Y. But I think I'm going to try to talk the talk and walk the walk as well. But we'll see how hard that is, when the rubber meets the road, because I totally get it that it's not, there's the research and me sitting here saying this in over Twitter, right? But there's also where the rubber meets the road, and that conversation can be hard depending on who you're talking to. But so I'm still early into it, but I would love to hear from parents who have had success, and I have had parents come up to me with success stories of how they've been able to use the research to kind of advocate for doing something else with their child, or not doing X, Y, and Z. And people, coaches, administrators have been open to those suggestions from those parents. So it's not impossible, but it might be unique.
I'll just give you a 5-minute blur. I have 3 children. They're all middle school. I have a freshman in high school, 2 middle schoolers, and I am struggling a lot. It gets much harder. And I have a gymnast. I have a multi-sport athlete, and then I have an older one who dabbles in multiple sports, but ultimately is getting selected out. So I have 3 very different situations, very different athleticism in all 3. And it is really hard. The pressures are on as the kids get older. And unfortunately, they have a mom who's in the know, which is tricky, right? Because, and I have my gymnast. I'll tell you, I keep her, she's 13, and I keep her at 11 to 12 to 13 hours a week of gymnastics. I think that's a really good recommendation. And I try to have her, fortunately, gymnastics has created an Excel track where you can do that and do other things. And I think it gets harder, but it's really important.
It's always good to hear from parents that are doing it and making it work.
Yeah.
Hard. But
yeah, I know. Hopefully by the time my little one is in that, you guys have fought the battle for me.
I think just one last thing is get them outside to play. Again, if you can do that, if we get our kids outside to play, then your neighbors will get them outside to play, and their neighbors will get them outside to play. So get them outside. It's really important. And we'll end on that.
Perfect. Yeah. So thank you guys both so very, very much. Just for all the audience members, if you know if somebody was not able to watch this live and they would be really interested, or pass it along to another parent on the soccer field. This is going to be in podcast form and up forever on the JAT's YouTube channel. So thank you very much, Andrea and Dave. It was wonderful talking with you guys, and there's so much wonderful, valuable information in the special edition. So thank you.
Oh, my pleasure, of course.